Marcus. I'm the CEO here at the Ingham Institute for Applied Medical Research. Absolutely delighted to be hosting this event today with great support from Multicultural New South Wales, and to have our researchers and some of our friends from the healthcare community come along and speak about various aspects of health for our guests' families and their children, and how to access some of those health support services in the community, because there is a lot there that's available for people here in Southwest Sydney.
My name is Prue Matthews and I am a child and family health nurse.
So our service does well child growth and development checks.
I think it's really important that we come to community events because it gets our message across, especially with people that come to Australia as immigrants or refugees. They might not be aware of our service. The general public will know about our service and be able to access our service. And even today I've had the opportunity to speak to other service providers, so they also know about our service, because if they're seeing a population of the community that needs health assessment, they'll know where to actually send them to. So I think that's really important.
We're about to start our clinic in the Fairfield Community Health Centre, which is going to be based in Carramar.
My name is Dr. Aileen Smith and I work at the Academic Primary Integrated Care Unit. My role here is research, teaching, as well as service development. I think the value of having these kind of events is that it brings people together, and it also, most importantly, shows the community that they're not alone in their healthcare, and they have a lot of services that are around them that can actually help them navigate the myriad of health services that are available in Southwest Sydney. The value for us as the researchers and the doctors here is that we get to meet the people that we are providing services to. And I think that's a very good reminder of why we're here and why we're doing what we're doing.
You don't need to have a healthcare card to access the public dental services, and you call up the call centre and they will decide which is the appropriate clinic to.
Hi, my name is Ajesh George. I'm an associate professor and I'm also the director of the Centre for Oral Health Outcomes and Research Translation here at the Ingham Institute. What we do here is we try and raise awareness about the importance of oral health in the community and with other health professionals. Today was all about connecting with the community and raising awareness about one particular area which is important, is the oral health of young children. So as researchers, and we try and improve the quality of care without events like this, where we can highlight what we're doing, showcase where they can access information and services, is very important, because we can then improve or increase the translational part of our research much faster than sitting in an office and hoping that this will happen through your contacts.
The clinical trial has 5 stages. In the early phase, the medication is tested.
Hi, I'm Jennifer. I'm the clinical research manager of the Medical Oncology Clinical Trial Unit. The patient can receive this medication at no cost at all. This event is very important because we can share this value of the clinical trial to the community, so they can know not they testing the medication to them. They have a lot of benefit they can receive from participating in a clinical trial.
I've been invited here today to the Ingham Institute to find out the pathways into health and how to access health, specifically for refugees and newly arrived migrants. I found today very helpful in terms of the information, where to go to if you do get asked those questions. I have found for a lot of the time there is a gap in the industry in terms of community and health. So hopefully today we see that gap come a bit closer.
Research really should be driven by people like yourselves, who are in the community and see what's happening every day. But again, thank you for joining us this morning here at the Ingham Institute.